Respected teachers and dear friends, today I am going to take a seminar on the topic World Health Organization. I have prepared a presentation on this topic. Now let's get started. The World Health Organization is a specialized agency of the United Nations responsible for international public health. When the League of Nations was formed in 1920, they established the Health Organization of the League of Nations. After World War II, the United Nations absorbed all the other health organizations to form the WHO. The Constitution of the World Health Organization was signed by all 51 countries of the United Nations and by 10 other countries on 22nd July 1946. It thus became the first specialized agency of the UN to which every member subscribed. Its constitution formally came into force on the first World Health Day on 7th April 1948, when it was ratified by the 26th member state. April 7 is celebrated as World Health Day every year. Objectives of WHO. WHO's objective is the attainment of the highest possible level of health by all people. Health is defined in its constitution as a state of complete well-being and not merely the absence of disease or infirmity. As of 2012, the WHO has defined its role in public health as follows: providing leadership on matters critical to health and engaging in partnerships where joint action is needed, shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge, setting norms and standards and promoting and monitoring their implementation, articulating ethical and evidence based policy options, providing technical support, catalyzing change, and building sustainable institutional capacity, monitoring the health situation and assessing health trends, CRVS, civil registration and vital statistics to provide monitoring of vital events like birth, death, wedding, and divorce. Next, the headquarters of WHO. It is situated in Geneva, Switzerland. The World Health Assembly. WHO is governed by 194 member states through the World Health Assembly. The World Health Assembly is the legislative and supreme body of WHO. Based in Geneva, it typically meets yearly in May. It appoints the Director General every 5 years and votes on matters of policy and finance of WHO, including the proposed budget. It also reviews reports of the Executive Board and examines the report to find whether there is any further areas of work. The Assembly elects 34 members technically qualified in the field of health to the Executive Board for 3-year terms. The main function of the board is to carry out decisions and policies of the Assembly, to advise it, and to facilitate its work. The Chairman of the Executive Board of WHO. As of May 2020, the Chairman of the Executive Board is Dr. Harsh Vardhan. The Director General of WHO. The head of the WHO is the Director General elected by the World Health Assembly. The term of office is 5 years. The current Director General is Dr. Tedros Adhanom Ghebreyesus, who was appointed on 1st July 2017. Achievements of WHO. According to the World Health Statistics 2015, given by WHO, the following are the achievements of WHO. Globally, a reduction of 40% in cases of undernutrition among children. Child mortality under the age of 5 years has declined from 90 deaths per 1000 live births to 46 deaths per 1000 live births. Globally, 1.3 million fewer new cases of HIV were reported from 2001 to 2013. A coverage of over 80% of immunization has been achieved. Diarrheal deaths have reduced significantly. Cholera and plague epidemics are rare occurrences now. Leprosy has been managed better and the guinea worm has been nearly eliminated. Smallpox has been eradicated. India has been declared polio-free country by the WHO. And finally, the functions of WHO. The WHO performs the following functions. It helps countries to improve their health system by building up infrastructure, especially manpower, institutions, and services for the individual and community. It gives important drugs needed for medical care. The WHO launched a program to immunize children against 6 major diseases: measles, diphtheria, tetanus, tuberculosis, polio, and whooping cough. It promotes research to cure and prevent diseases. For example, it arranged for the investigation of cancer in many countries to improve vaccines and to train research workers. It works towards providing safe drinking water and adequate waste disposal. It organizes conferences, seminars, and training for healthcare personnel from different countries. It aims at fighting diseases and preventing them from spreading. Malaria eradication program continues to be the world's biggest health program. It defines standards for the strength and purity of medicines, including biological products. It makes special efforts in combating diarrheal diseases, which are known as killers of infants and young children. It publishes health journals like the Bulletin of the World Health Organization to create health consciousness among people. Hope all of you have understood about WHO. Thank you.